Okay, let's go ahead and get started. I'm going to give you an overview of Chapter 1 and give you an idea of what the highlights are of that chapter. Definitely read the chapter. Start off with accessing your health, why health and why now. And one of the big things is they have great chapter summaries at the end, and they also have a little quiz that you can take at the end too. So let's go ahead and get started. The learning outcomes for this specific one is I really want you to know the difference between medical model and public health. So really understanding the difference between how medical model looks and approaches medicine compared to a community health, public health model, understanding what those services are. There's a real link between community needs and public health services. So what you'll see is that Kern County has a lot of needs, and really we need to make sure we can identify what those are. And then we're going to start to look at the different strategies out there. I also want you to understand that, and I'm going to go into this in week 2, but health behaviors, how do you change them? Because individual health behaviors do affect the whole entire community. I talked about comparing the medical model compared to the public health model. And then I want you to to know the different data sources out there, the different things that out there that show us how KERN's doing. So let's start off with public health. What is public health and community health? It's different than the medical model where you go into the doctor and the doctor says, you've got an infection or you've got this and you're going to need to take this pill, and they treat you and you go home. The difference with that and the public health model is public health is really looking at the whole entire population. It's looking at preventing problems before they happen to people, and it's very much into promoting health care and making sure people have access. Now, here's the thing. Individual health, it's influenced by your environment and what's around you and your community. But when you look at a person with their individual health, they have environmental health, like where are they living? Are they living near a place that has good clean air, good clean water? Are they taking care of themselves physically? Are they working out? Are they walking? Are they moving? Are they sitting in front of Netflix and pounding on food and not doing any type of exercise? Their social health, are they living in a place that and actually, do they have relationships with people that are healthy? So they're not living in a place that's or actually have a relationship with someone who's abusive to them, or have friends that are very supportive, or have friends that are doing healthy things. Intellectual health, that's like going to school, doing puzzles, like really pushing your mind to think. And now emotional health, that is a little bit different. It's kind of similar to social health in a sense that you're impacted by what other people are thinking and your environment. But emotional health is more personal in how you are handling that. How are you handling that? Handling the ups and downs of life. And spiritual health is about that connection to a higher being or to a purpose that's beyond this world. So spiritual health includes religion, but spiritual health could be someone who likes to meditate or walk and be outside. It can encompass all those things. So health goes on a continuum. You could have irreversible disability or death. I mean, that's just obviously way down on the scale. Think of a chronic illness like asthma, diabetes, and then you have signs of the illness that pop up, and then you have signs of health and wellness, then you have improved health and wellness, and then you have optimal wellness and well-being. You could slide across that scale at any given time. Sometimes you can be in a place where you have signs of illness and you're able to pull it back up to wellness. Or you could be in a position with chronic illness where, for example, with sign of illness, if let's say someone has pre-diabetes or about to get diabetes, They could maybe pull it back to being healthy, but at one point, there's just this no return, and they're stuck with trying to manage chronic illness. So chronic means ongoing. The goal is to constantly be monitoring and taking care of oneself so that you're in the optimal wellness and well-being. So what is health? I mentioned before medical model versus public health model. So what is really the difference between that? So a medical model focuses primarily on the individual and his or her tissues and organs. So see page 4, it gives you a definition of this. So it really focuses in on the individual. Public health model views diseases and other negative health events as a result of an individual's interaction with his or her social and physical environment. So your environment really can influence your individual health. But also, let's say someone's nearly not taking care of themselves or not vaccinating or smoking, their behaviors, drinking and driving, could actually affect the community. So public health model looks how the individual affects the community. Here I'm going to test you out now with this question. Let's see if you get this. Test yourself. The medical model of health would most likely focus on which of the following? A, controlling air and water pollution. B, lifestyle interventions to prevent chronic diseases. C, treating bacterial infections with antibiotics. And D, serving marginalized populations. So marginalized means, populations that aren't getting care. So which one do you think the medical model would be? So this would be on the left side. And the answer is C. Let me move this out of the way a little bit more. Nope. Oh, no, we want to go back. Oh, no. So it's down there. I can't move this thing at the point. But C, treating bacterial infections with the antibiotics. This one right here. And I could do a little draw. This one. It's the medical model. All these others, A, B, and D, are the public health model. I bet you I can highlight these. Whoops, nope, I can't. Erase. Boom, get rid of that. So A, B, and D are the public health model. They're going to look at air and water pollution, the lifestyles of trying to prevent someone before they get sick, but whole populations, because you think about it, you prevent one person from getting heart disease is one thing, but if you can get information out there to get a whole population, like thousands of people, to keep them from getting sick with heart disease, you do major, major changes. So public health looks at the whole entire community. Right, I'll go ahead and get rid of this. There we go. Okay, moving on. So here are some of the big, I'm going to erase this. Looks like it stays there after it comes over. Here are the big 10 greatest public health achievements. Vaccinations. Big. Some of the biggest and think about it, polio. You don't hear about polio anymore. Measles. Yes, you do hear about measles because we've lost herd immunity. That's when people are not getting vaccinated. So some people have been exposed and we're having outbreaks of measles again. Have you heard of smallpox? That used to wipe out whole populations. Not anymore. It's been eradicated. So vaccinations are a way to really create immunity, but also to really control a disease. Motor vehicle safety, seat belts, workplace safety, huge. People used to be exposed to all kinds of chemicals. And controlling infectious disease, you know, really, if we have an outbreak of something, the health department comes in and does quarantine and control it. We've made a big reduction in cardiovascular disease and stroke diseases. Do you worry about where you eat? Yes. Yes, making sure it's healthy and safe. So those grades that go in there, the ABC grades that go in restaurants. Maternal and health infant care. It used to be that a mother would die in childbirth, a big, big probability, but now the chances of that has really gone down. Family planning with the condom and the pill being introduced in the early 60s completely changed a lot of things, and people could actually control when they were going to have a baby and plan. And let me tell you, research shows over and over again that a baby that is planned is a healthier baby. So parents who plan for children, they can anticipate, and it makes total sense. They're more prepared to have that baby. Fluoride drinking water, that's prevention of cavities. And then I can't tell you what tobacco has done. By reducing tobacco, we've reduced lung cancer like you wouldn't believe. It is like dropped significantly. Okay, so moving on, let's see here. I'm going to go ahead. And get rid of this thing. Okay. Yeah, good. Whew. Excellent. Okay, moving on. So one of the things I want you to do is I'd like you to check out This is Public Health. I'd like you to check out the Public Health Barron website, the Facebook Public Health Science, and Twitter, because there's a real movement into really making people understand what public health is. I bet you if you go up to people and you say, what's public health? A lot of times people kind of look at you and go, oh, that's like a nurse. Oh, that's like a doctor. No. So I'd love for you to kind of go out there, and one of the things I'm going to have you do in this class is take on some different projects. So kind of take a look at some of the things that people have done in the past. I've had people do public service announcements, brochures, and different kinds of things to kind of get the word out there. And so you're going to be doing some things in this class around raising awareness on some real important health issues, because it's not just about personal health and wellness, it's about our community too. So check those out. And I wanted to talk to you about the different positions that are out there. So one of the things that is really big in public health is a health educator. And they are people that go out, work with raising awareness. And so the idea is that if you change people's personal, individual behaviors, you can impact the whole entire community. So a health educator, it works across a lot of disciplines. And I used to be a health educator at the health department. And I can tell you, I used to work with CHP. I used to do presentations in the school. There's nutrition education. And so that's something, car seat education. So a lot of times we go out and we talk to people, and I want to put that out there that with this personal health and wellness class, if this is something that you enjoy doing, this is a career that maybe you should think about. And then of course we have careers in administration. And so those are the people that are heading up the hospitals and doing that. And they're really, really working on controlling the cost. So believe it or not, our healthcare is out of control. Did you know that we are the most expensive healthcare in the world? But we're not the most efficient. Yes, we have an amazing medical advances made here, but we have some serious disparity in healthcare. And yes, it's very political, and people have had all kinds of ways of approaching it. But the reality is, and that's something we need to talk about, is that medical care is something that's really difficult to get. And quality of medical care can also be something that's very difficult to get. And people sometimes don't understand what good quality medical care looks like. So we're going to be going over that in this class. I want to put out there also that if you're interested in health administration, these are the types of jobs that a health administrator does. And this is a person that's looking at the cost of medical care and also making sure that people have access to medical care. So typical, you hear about doctors and nurses, different types of positions like this, but there are many positions out there just working on raising public health awareness, health promotions, and making sure people have access to care. So think about that. So let's talk about some terminology that I'm going to use that you'll hear in the healthcare area. And the first is, I want to test you out. What is the term used to describe the expected number of years of full health remaining at a given age? Do you know it? Ready? Life expectancy. Here's another one for you. What is the term that describes death rates? Mortality rate. What is a term that describes illness rates? Morbidity. Sometimes you might say someone you might hear this term, morbidly obese. It's because they are, it is pushing illnesses. So illnesses is morbidity. Mortality is death rates, and life expectancy. So let's talk about life expectancy with certain diseases. And some of the number one, actually not so much life expectancies, I should say mortality rates. So the number one cause of death, and you should know this. So I don't want to bring up I'm scared to do the little pen again because it took me a while to get rid of it. But I'm going to use my little cursor here. You need to know, and at one point I think I'm going to put out a little Kahoot or a little game to see if you know this. Diseases of the heart, number one. Cancer, number two. Respiratory illnesses, number three. Strokes, number four. And then accidents. But as we start to go down by age group, look what happens in age 15 to 24. Accidents takes number one. Homicide, number two. And suicide. So accidents, again, go up there in 25 to 44. So I want you to know the different causes of death. And at one point, I'm going to put a little pop quiz out there to see if you know these. And yes, this is where, take a note. This is where you can come back and you can look at this. And this is also in your book. Continuing on with the 45 to 64, you start to see it change. You see that accidents aren't at the top now. They're number three. Age 65 plus, we have the heart disease again. So when you look at these different diseases, I want you to know that each thing's behaviors, and what's really interesting about all this is that all of these have behaviors that control them, make it worse or make it better. Yes, genetics plays into this. You could have a congenital heart defect, sure. But behaviors really can influence this. So look at these different causes of death and look and think how a behavior, like what someone does, could affect that. So I could take one with accidents. People not wearing their seatbelts, they're 4 times more likely to get killed in a car crash. Not being in a car seat for a child, really, there's statistics around that. Diseases of the heart, smoking, huge, really influences heart disease. Nutrition. So these are just some of the examples. So I want you to consider this. This is not going to be a discussion question, but this is the kind of stuff we think about in this class. You might see this kind of thing pop up later, but I want you to think right now, do you think it's realistic to expect people to consider behavior change relative to their health? Do you think that people can change their behavior? I could say yes, if they're very motivated. If they're not, then you'll see that no matter how much knowledge and things that you pump at them and tell them, that at one point they're just like, back off. And next week I'm going to be talking about the different models of behavior change because yes, behaviors can be changed. It's just not simple. Now consider this. What's the cost of health behaviors? Is it fair? Because really, if you look at our healthcare costs, some of the big costs and our trends with diabetes and obesity rates, they have really taxed our system. For those who are smoking, it really puts a big pressure on the system. So, you know, I'm not going to test you right now, but it says here, test their preparation for class by asking them why today's children may have a shorter life expectancy than their parents. This is something that's come up. Are parents responsible for the overweight issues we see in children? Or does the school system or even food manufacturers have responsibility? Because there are things that we can do that can really influence behaviors. Having access to sugary drinks, for example. Mega-sizing the drinks. Not having water available. I don't know about one of my chief complaints as a health educator was seeing the food that's served in schools. High fat content. And I have to tell you, sometimes I'd look in the trash can and I would see whole trays dumped into the trash. Food just wasted because the children didn't eat it. Or they would just grab the French fries. I used to be a teacher. So I'm just telling you that these things, are these things fair that we have to do this cost and this burden? And this is a big debate. Where do you start to infringe on people's individual rights? Think about that. So personal choices do affect people's life expectancy. And so there's been some big changes in public health. Remember I talked about vaccinations? So that became a mandate for schools, and we started to say you had to get vaccinated a while back, although there are people who refuse to vaccinate. And one of the big things they have to do is keep their child isolated so that they do not expose vulnerable populations. But one of the big things we started to put legislation in. So think about this: just over 100 years ago, which isn't a lot. This is in one lifespan. Someone over 100 years ago, about 47 years difference in the early 1900s, and then it increased to 78.7 years for a child born in 2011. But I have some very depressing news to tell you. And you're going to see this in our modules, and I want you to watch this video about the zip codes in your modules. It's going to be there. And then also, there's an article that Harold Pierce wrote in the Californian. Kern County, in some communities, has lower rates than developing countries. So our community really suffers with this. So we're not at 78.7 here in Kern County. We're well below some of the life expectancies in other parts of the United States. We really struggle with this. This is very relevant to us. So, and you're going to see that in the modules. In 1900, over 30% of all deaths occurred among children under age of 5. 30%. That means 1 out of every 3 child would die, approximately. So in 1900, I want to quiz you here. What do you think was the leading cause of death? If you said infections, you're right. With the development of what and what, life expectancy increased dramatically and the leading cause of death shift to chronic. Chronic being, diabetes, heart disease, things like that. Chronic is like an ongoing, not curable, something that's ongoing. So what do you think it is? Let's see if you can get it. Antibiotics, big, huge. Although we're starting to use antibiotics and we're starting to get antibacterial resistance. But that's another story, another day. But antibiotics, big. And vaccinations. So life expectancy has really increased. So personal choices really do affect global, and they do shift the burden. So 21%, however, of our current medical spending in the United States is due to obesity. Yes, it's a big issue. And then if you want to, you can click out on this obesity data prevalence map, and you can see our trends starting from the 1970s and going from blue to dark red. So check that out. So I want to tell you that this is a terminology I want you to know. I want you to know that non-modifiable determinants are things that are genetic. You can't change. And we get that. You might be predispositioned to diabetes. You might have a congenital heart defect. But they're modifiable determinants that you can actually change. You could change the sugar intake. You could do walking. You can stop smoking. These are things that people can do. So non-modifiable can't change. Modifiable can change. And so one of the big things that Healthy People 2020, that's the big government agency, Federal Department of Health and Human Services, says that basically health outcomes have to do with individual behavior. This is a great test question. Biological and genetics. I mean, there's biology and genetics in play. Social factors, and I want to tell you this one's huge. Having stress, being exposed to trauma, they have found direct positive correlations to people having heart disease and diabetes and all kinds of chronic illnesses later on. And so when you read Harold Pierce's article about toxic stress, you're going to see in Kern County that our exposure, social factors, has made us really high risk. So social factors are big. Policymaking, that's the laws and the regs. So, California going smoke-free in some areas, or schools pulling back the sugary drinks, that can make a difference. And then having access to healthcare, big. Those are your health services right there. So these all affect healthy outcomes. So I want you to also take a look. This is something that's hyperlinked on here. This is where I got it from, Healthy People. And they set goals and targets for us to reach. And then eventually, and this is hint, hint, hint. This is where you can see health disparities. So one of the things I'm going to ask you to do is to put a link to health disparities. And what you could do is you can actually, I'm going to go ahead and click out on this. And I'm pulling out, let's see here if I can make sure I can do a screen share here. And I'm still screen sharing with you. Here we go. And this is a comparison of all the different areas. So you can see our community dashboard. And so let's see here, disparities dashboard. So this will show me that you actually listened to this whole entire video. So right here, if you can go out and you can find a disparity, and what you could do is you could put a hyperlink, by Control-C, copying this link, or taking a screenshot and then putting down where we have our disparities. So right now, we have adults with healthcare insurance. We're actually doing pretty good. We're doing good with private health insurance. Children with health insurance, we're starting to go into the yellow. And so this is Healthy People 2020 target. Remember, their target, they set targets. Remember, I just mentioned that, 100%. I'm not going to get it. People delayed or had difficulty obtaining care. People with a usual source of health care. So what this is showing is that we have very limited access to health care in our county, 84%. So that means there's a significant percentage of people who are not. And look at this. I love how they break it down here so you could see who's getting access. And it looks like the 18 to 24-year-olds don't have a good source of health care. So you can see it by race and ethnicity too. So you get the idea. You can go through this and you can see our disparities. Okay, I'm going to go back out to screen share, and I'm going to get back to my desktop. And I'm going to go back to my PowerPoint. And there we go. So you can really see the different cares, it's different access here. I'll get back on this. So we need to monitor our needs. We need to always look to see how we're doing. And these are different places that you can also look to get disparity information like the county health rankings and roadmaps. And here's our Kern County data. This shows you how we're doing overall. Everything in highlighted in red means that we are over the trend. Adult smoking, adult obesity. Our food environment index, you want that number to be high, not low. So we actually have very limited access to good, healthy food, physical activity, access to exercise opportunities. We have alcohol impaired deaths, 33%. Yikes. And then our STI rates are some of the highest in the state. And our teen birth rate, we are number 1. So I don't mean to depress you, but the reality is that we have a lot of needs here, and we do need people in our community who are proactive in participating in health education. And I find it ironic, and this is just me going on my soapbox here, but public health degrees and public health careers typically have not been promoted in Kern County, and BC is the first in the area to provide a public health service, public health degree, the first in Kern County. So if you go to other areas like Los Angeles, San Francisco, Fresno, they all have public health degrees. They all have higher level bachelors and masters, and they have their community colleges have it. So it's interesting. This is just started here in Kern County. So if you join this class because you care about making a difference, I'm going to be providing opportunities for you to be proactive. And if this is a career thing that you're interested in, I will be posting careers because you can make a big difference in Kern County. Everything you do does matter. And then this gives you another idea of how we're doing in Kern County. So this is what I want you to do next. Oh, I also want to promote one more career, environmental tech. So you can also look at water, and this goes over the fact that we have higher lead levels, and that's something that in the environment in your water really determines that. Social factors, I talked about a little bit about that, how we need to address that. So having access to healthcare, good housing, good food, good secure employment. And so start thinking about that. In Kern County, these are some areas that we really struggle with. How's our environment? How's our roads? Is it safe to bike here? How about air quality? Do we have good air quality here? I know you're all in your homes going, no, we don't. But there are things that we can actually do to improve our air quality. And I have the best speaker that is going to come to campus and really talk about that. And when that happens, and we have this great Rose Foundation grant that we just got, there's going to be an opportunity for you to participate in some activities if you're interested, both offline or online. I'll be posting about those. Policymaking. You can make a difference with policy. And so I want to kind of end with this, and I hinted before that I want you to find a health disparity. So first look and see how a health disparity is defined, which is on page 11, which basically what you do is you're looking at where things are not equal. We're not equal in the sense that, not equal in the sense of not having access. We're not with the norm. So differences in the incidence, prevalence, mortality, and burden of diseases and other health conditions among specific populations. So Kern County as a whole, we're a population. We might have something that's higher than the rest of the United States, or a subgroup like white males or African and American mothers, can have higher or lower rates. So look at health disparities. Older adults having limited access, or younger adults. These are anything that just shows that it's not equal. There's a disparity. There's a difference. So one of the assignments I've asked you to do is to go out and find a hyperlink, and you can go out to that website that I just showed you in my PowerPoint, or you can find another one, and I want you to actually post a URL showing me where it's at in Canvas. So here's an example of a disparity I showed you. Well, actually, we're starting to get close to it. And then having access to healthcare, that could be a disparity too. So now I want you to take a look at the assignments under Canvas, Module 1 or Week 1. And I want you to go ahead and watch the movie called Zip Code and Health. And then make sure you read all the hyperlinks in individual and community health. After you've watched those, watched the Zip Code and Health, and you've read the hyperlinks in individual and health, then go ahead and post a comment. Actually, not so much a comment, but you're going to respond to it. And then with health disparity, I just want you to post a hyperlink with a sentence, and you'll see that there are directions in each one of these modules. And then your homework, assessing individual health and community health, it's open. And you could take it as many times as you want, and it will close on December 1st. Now, here's a big hint to you. The quizzes are directly tied to the homework. So doing the homework gets you prepared for the quizzes. And they're not stressful. You could take them on your phone. The homework as many times as you want. It's completely open. So the deadlines are firm with the assignments. Now, in week 1, I will be a little bit, I'll give you a little bit of wiggle room. So I know that we're all kind of going to get into the groove. But pretty much I'm always going to be posting things on Thursday during midweek, and then it will be due the following week. You'll see this trend. Post on Thursday, due on Thursday. Post on Thursday, due on Thursday. I'll always give you about 1 week. And do not fret. If you stay on top of it and you get the announcements, I will always keep you up to date on everything. And listening to these modules will help significantly because then you can see what is due. You'll get it. We'll get a trend going. If you have any questions, please ask them in the general frequently asked questions area. And if you have any individual concerns, please go ahead and message me under Canvas directly to me. All right? And then I am also going to have virtual hours. So I will have every week, I will make sure that I'm online Thursday night, starting at 7 p.m. for at least a good 2 hours or at least 1 hour, but I'll be there for a significant amount of time so that we can chat, talk, even have a Zoom conference call if there are a whole bunch of people who have questions. All right? Great. I look forward to seeing your post and seeing your thoughts.